Functional Health Centers. Today we're going to be talking about why quick fixes don't last.
Mm-hmm.
Right? So, I mean, like, here's the problem. Like, most of us do things that are just temporary, and we don't even know that they're temporary, though. So we're doing lots of stuff in our life that make things feel better, but really not do anything about the root cause of the issue. And I mean, sometimes we even think this is just the standard. This is how we make this feel better.
Yeah.
Right? I mean, like a massage, right?
Mhm.
So I go to get a massage from my neck and my upper back because they're always tight, always tense. So it's just work. Just work makes my neck tight. It's just because I'm stressed out. Get a massage. A couple hours later, I'm tight again, right? So I never did anything to actually correct the reason that my neck was tight. I just got a massage and make it feel better for a minute. Right? So that's a quick fix. That's the kind of thing that we're going to talk about.
Yeah. And we do this with everything. We'll do it with headaches too, right?
Mhm.
So like we get headaches and we're just like, oh, well, I got another headache, whatever. I'll take Excedrin, right? But we all know Excedrin isn't really like the reason you got the headache.
So my lack of caffeine and Tylenol.
Right. So it's like it's a chemical fix, right? So we're taking the Excedrin just to numb it all out, right? And we know that, but those are the quick fixes that we do in our life, right?
Yeah. It didn't do anything about the root cause of the problem. It's not fix the reason I get the headaches. Right? It's just masking the symptoms of my headache until that headache is gone. And then it comes back and I do it again.
Right.
So go ahead.
Yeah. So we're going to talk a little bit about this today because we get this in the office all the time. So whenever we are treating a patient, what we do is we address the whole body, right? And the reason we do that is because everything in the body is connected, right? The head is connected to the neck, it's connected to the shoulder, right? It's all connected, right? But patients, whenever they're here, they will often say, like I came in and I got like low back pain, but why are you working on my neck? Now it's kind of funny whenever I think about it, it's kind of funny because they pay us to fix their low back. Fair, right? And so what we're doing is we're like, great, you're paying us to fix one area, but what we're going to do is we're going to fix the whole thing, right? But they're like, well, that don't make no sense. Why would you fix the whole thing when I just have a low back problem and that's all that I need to have fixed, right? Because it's that mentality.
Yeah, my hamstring's tight, so I'm only going to stretch my hamstring.
Right. We don't. We're not really connecting the whole point of that. It's all interlaced together, and in order to truly fix anything, you have to get to the root cause of why it's going on in the first place.
Right. And even the example of the hamstring. So if I've had a tight hamstring for more than a couple of weeks, my body's already started to compensate. It's already changed the way that the neurology and the surrounding tissues work, and even changed the way that like my muscles are working. It started to adapt. I've changed my posture, my position. My body's really started to change everything just because I had this one small injury to a hamstring.
Right.
And so like, there's so many things that build up in a cascade from just one small problem. And by the time you do something about that problem, usually it's not the first day or the second day. It's been a problem for some time.
Right.
All right. And so we got to undo all those changes in order for us to really get the root cause of that problem. That's our ultimate goal for our patients, is that if you come to me with some lower back pain that's been persistent for a couple months, I'm going to fix it. I'm going to fix anything that could make it come back.
Right.
Right?
Yeah.
Because I really, like, the worst thing for me would be a patient that has a relapse of the same problem. No, we're not going to do that. And so we're going to do everything that we need to do to make sure that it doesn't come back ever again. And then we really address the root cause of the problem and we can get everything fixed in that area.
Yeah, we have a bunch of fixes, right? So a lot of short-term fixes that people are often reaching out to, right? So I kind of already mentioned like a chemical fix, right? So ibuprofen, Tylenol, medications, things like that, painkillers, where people are often really quick to gravitate towards those because, I mean, hey, fair.
Cheap, fast, and easy.
Fair. When you're in pain, let's get out of pain, but we all kind of know that that's not really going to fix the issue. It's just going to mask it. But also some other ones like just the adjustment, right? So that can also be just a quick fix as well. because rack 'em, crack 'em, we're loosening up the joints, but we haven't addressed anything else either. So that can be another way that people just try to go in, quick fix, just give me that quick adjustment. Let's just get that done, right?
So many people end up in just to maintain, they're getting adjusted once or twice a month. If they don't get that once or twice a month adjustment, everything goes off the rails again.
Right.
I hate being somebody's Band-Aid.
Yeah.
That's definitely not my goal for my practice and what I'm doing. So,
yeah. And also like bracing, right?
mhm.
A lot of people ask us about posture bracing because we do a lot of posture rehabilitation. And that is another super quick fix, right? You just go on Amazon, boom, boom, $15 later, you got a posture brace. But in order to correct the posture, it is going to take so much more effort than just strapping on a posture brace on you. And in all reality, just like all quick fixes, that's going to make it so much worse later on because once again, you've never got to the root cause of why you have poor posture in the first place. But whatever you were doing to maintain the posture that you currently have, you will no longer be utilizing that. You will be using the posture brace, which then you have to use all the time.
Got to wean you off of that.
Yeah, and then we got to wean you off of that. So it's what was that one?
Let's see. It's really tiny on the screen. Sorry.
Yeah.
It's a very rare disorder called Klinefelter syndrome.
Oh, yeah.
And she's tired of being in chronic pain and feeling like a 8 years old. Oh, like she's old, right? And she's not even 50 yet. What can she do?
Oh, yeah.
Mm-hmm. So, Klinefelter syndrome, those types of conditions, it's more of, it would be learning to adapt to the symptoms and managing the symptoms that come from it. There's not a solution per se, but there's a lot of things that you can do to help manage the symptoms of that. Dietary components would be super important in that scenario as well. So just like a random stretch for you would just be almost pointless because it's just going to continue to be a problem. So really a well thought out functional plan of movement and function and metabolism. So what's happening on the inside, that would be really necessary for you to even be able to maintain. If you could get into a groove that was maintaining a reduced inflammation system and some stability in the system. So the series of exercises that you do on a consistent basis is combined with some neurological stretching. That's the best potential that you'd have to maintain the symptoms so that you would live a happier, better life. You'd always have the condition, you'd always have the potentials for those problems if you didn't maintain that system. And that's pretty situational for that, right? Mm-hmm. Tired of being 80 years old. Yeah. Tired of feeling like you're 80 years old. Yeah, we hear that all the time.
We do. We do. We hear 20-year-olds say,
right.
I don't want to feel like I'm 80.
Yeah, and we get lots of patients that have connective tissue disorders and everything else. So we think Ehlers-Danlos syndrome, lots of different things. It's we can get them to a place that they can manage, 95% to 100% functional capacity. So their body functions really well. They're able to make it through normal everyday events and activities. And that's definitely where we'll get some of those maintenance of the symptoms and the problems pretty well. I'm always going to tell them that they have to maintain it, though. There's no solution to that. Right. All right. Let's see. We are spouses, by the way. So this is my wife. So yeah. All right, let's get back to different things. So we got stretches.
Yeah.
Right. So lots of people stretch. My hamstrings are always tight, so I'm gonna keep stretching my hamstrings. Why are your hamstrings tight? Right.
I always like to say if it's tight for a reason. It's kind of like my go-to because we're all so like ingrained to think this is just the way it is, and I'm just tight.
Ever since junior high, my hamstrings have been tight.
Right. And so I'm just tight. And we keep trying to stretch the same thing over and over again. But if it's tight, so it's tight for a reason. It's tight because your body is trying to save you from injury. So there's another muscle that is usually compensating, right? That's a little bit weaker. And what's happening is this muscle is holding on for dear life, and it's trying to just maintain the structure for you. And it's saying, don't go any further, don't do this. And it's serving a purpose for you. And so what we're able to do is whenever we go in, we break up scar tissue, we get other muscles working as they should, then everything starts working biomechanically, and that muscle, it's able to let go. It will let go when it wants to let go, when it is right for it to let go, if that makes sense.
Mm-hmm. Looking at the notes there, or the comments. Sorry. Got it. How about muscle only fixes foam rolling? We talked about foam rolling.
No, I hadn't talked about
foam rolling. So a lot of my
but
runners,
it's kind of similar,
right? A lot of my runners and athletes always be like, "Oh, I'm always foam rolling my IT band."
Mm-hmm.
Hey, you got a knee problem, man.
Right? Yeah.
You got something wrong with the alignment or the function of your knee. Quadriceps isn't working well together. Like something's going on. There's a reason your IT band's always tight. It's not just because you're a runner.
Right.
Because something's not working right.
Right.
I got
if
plenty
you
of
feel
marathon
like
runners
you
and
have to, then
elite level
wrong.
athletes that don't have IT band problems.
Yeah.
Right. And so something's not working right.
Uh-huh.
So that's definitely a part of the scenario there. Like back to the whole body. Uh-huh. So if I got an IT band, a hamstring, my lower back's always a problem. Something's going on. It's changed the structure or the basic structure of what's going on inside of me.
Yeah.
And that change in just the basic structure is going to affect every piece that's attached to it. And so we're a machine. We're a well-oiled machine that functions intertwined piece by piece. So everything's very interdependent on the other piece. If I got a problem with the very base of my skull right here, it's going to cause problems in my lower back, and because it's going to change the way that my entire spine functions in reaction to it. If I got an ankle that's a problem on the right-hand side, I'm going to have a shoulder issue on the left-hand side somewhere down the road just because it changes the way that I walk.
It's so mind-blowing.
Right.
Everything's
so connected and interdependent.
It is so mind-blowing whenever you start to really think about it like that, though.
Right. And so, I was going to go somewhere with that. So, you can't have a problem somewhere and not have a bunch of problems in reaction to it. So there's no way to not have that compensation. It's subconscious. You can't tell yourself not to do it.
Right.
You'd be surprised how many times somebody walks in with a disc injury and they're like this.
Yeah.
Right. And they're like, I don't know. I'm just stuck like this. I can't do anything about it. I'm not leaning for this reason. I'm not making myself do this. It just is what it is. So you can imagine a lesser level is that I'm getting these little deviations that have changed the way I am. Mm-hmm. Almost unnoticeable to the patients.
Yeah.
And most of these things are going to change over a long period of time. So I may have a small tweak in my neck, and 10 years down the road, it's finally symptomatic enough that I want to do something about it. But my neck's been tweaked to the left-hand side for 10 years. It's going to affect the way my shoulders work, my upper back works, my center of gravity is going to change.
And you know what? You don't even realize.
No.
You don't even realize.
No.
Like, you think, other people can sometimes see it. Chiropractors definitely, if we see you walking down the street, we're totally judging the way you walk. We can't help it. But yeah, whenever it's you're often not going to notice those small changes because you've been present as you are slowly modifying and changing, and so it's almost like it's not there.
Sure.
Yeah.
So that's the point and premise of our system, our process, of the TrueForm system. So it's a pretty unique system. I don't know. We talk about it a little bit, but we don't really get into the depths of it.
Yeah.
We're addressing every potential aspect and every aspect that does show up. So we address you from head to toe. We do an assessment from head to toe. We do a functional exam from head to toe. We do an ortho exam head to toe. We're checking every single thing out from head to toe, and we're going to address all the finer nuances and the little bitty things that have changed over a long period of time. We utilize all kinds of great things. So obviously rehab, chiropractic, we use some postural corrective devices, different things that'll help us with, like the Pedibond system is going to help us with curve restoration. It's going to help us with malpositions within the pelvis, instabilities within the pelvis. And so we have means and measures that we can do to address just about any spinal or extremity issue that comes to the office, basically a joint issue. Mm-hmm. If you got a joint issue, you come into our office, we got everything planned out how we're going to fix that particular thing. We've seen, I think it's 30,000 patients in the office. So we've seen all the things. All the things.
We've seen all the spines.
In fact, I got 2 patients that have Kleefeld syndrome. So the congenital fusion, like I got 2 of them right now, right? So it's a lot of things that we see on a daily basis, but we know exactly what we're doing and how we're doing it and what the plan is going to look like to get to the end of that.
Yeah.
We've done it so many times. It's very predictable at this point.
Yeah.
We know, this is where we're starting. I know this is what it's going to take to get to the other side. And very objective findings and measures within it. So we're always doing those functional exams. We're consistently doing the orthopedic exams. We're consistently doing the postural exams, consistently doing the x-rays, and we're actually measuring the changes that the patients have throughout the process.
Yeah.
And so we got basically a study at this point that we could say, we know this is how you can undo all these biomechanical problems for a patient.
And it's because we don't just want to be a quick fix. We don't want to be another Band-Aid. And we want our patients walking away knowing, like, how do you take care of yourself, right? Because unless you're a doctor, like, you don't really know, and you're just kind of meandering your way through it. And like the gift of that knowledge is incredible. To know what you actually need to do in order to not have the quick fixes, in order to just be better.
Actually address the problem.
Yeah.
All right. And that's it. For the first moment you walk in the door, that's my goal. I want to find the root cause of the problem. I want to be able to explain it to you in a reasonable way that makes sense to just anybody. And then go through a constructive process and plan of what it's going to take for us to get back to normal and be able to actually reform and rebuild everything back towards that normal position.
Yeah, for sure.
And so we've spent countless hours trying to systematize everything to the point that we can make it very predictable for everybody and the patients. We know all the parts that go into just about every potential case or condition that comes into the office. So we have applications of what it takes to get through these systems. So it's really labor of love that we've gone through in order to build this system out, but it works really, really, really well. Super consistent. So 9 out of 10 patients are going to be 100% walking out the door in 12 weeks or less.
Oh, I know. I love it.
And so we're proud of it.
Yeah, for sure.
To say the least, we're proud of it.
Okay, so do you guys have any questions? We've already had a few of them, but we'll be on here for just a little bit longer. If you have questions, throw them out there. We'll answer them to the best of our abilities.
For sure, right?
Yeah.
What are some of the favorite things you've heard this week from patients?
Oh, me?
Mm-hmm.
So we have patients that come back just because they don't want to do anything on their own, right? They're all like, no, like, I love being here. I love the staff. I love everything. So I just keep coming, and I just keep showing up. I'm like, I love it for you. I love it for me. I love seeing your face. But yeah, like they're just saying that they're getting better and better and better and better and better and better. Whenever they first came in, they couldn't even tie their shoes without pain. They couldn't even tie their shoes. And now they're out building tree houses.
Mm-hmm.
Yeah, he's out building a tree house for his kids now. Like, that's remarkable. Like that's really cool. Yeah, so I love that one. That was great.
Had a Pilates instructor finish the TrueForm system.
I love that.
Pilates instructor, so she's an understanding of what the muscular system should do and how to exercise and how to work with her body.
Yeah.
And on the other side, she's saying just to get the foundational changes and how to function with that muscle made such a huge difference in how she feels, obviously, but how she exercises and how she understands her own body. And this is somebody that's trained to know other people's bodies.
Right.
So just to see the other side of that and just the changes that she's been able to make in her own exercises and her own journey through exercise. And she just, all kinds of praise about how good she felt and how much different she felt and how much more successful she was in her exercises.
I loved her. She's great.
So,
Yeah, I loved her. She's great.
So. All right, guys.
Yeah.
Really enjoyed it.
Okay.
We'll see you guys next week with something else. If you got any other ideas, questions, something that's always pestering you, send us a message through. You can do it through our website, texasfhc.com. You
So
can go to
true.
our Facebook page or Instagram page. You can always DM me directly.
Yeah.
You can always throw comments on any of our stuff through YouTube, and we can see if we can find that too.
For
But if
sure.
you've got any ideas, anything like that, let us know. We'd be happy to talk about it. Otherwise, we're going to keep coming up with our own stuff. We'll see you guys